Excuse me for 1 minute.
Hi, Alana.
Hi, Lana. Guess that means we can begin. I expect more people to be joining us. But I want to, be conscious of everyone's time. Let's do introductions, okay? Make sure everybody knows everybody. I'm Mary Anderson. I am chair of this committee for concerns of the aging. Good morning, everybody. Welcome. Ebenezer, could you introduce yourself, please?
Good morning, Ebenezer Smith, District Manager of Community Board 12, at your disposal, 212-568-8500.
And Ebenezer, just so you know, when Carol makes her presentation, she'll need to be able to share her screen as PowerPoint, okay?
Sure.
Joseph?
Sure. Yosef Kalinsky, Assistant Chair of this committee. Happy to see so many familiar faces. Hopefully it'll get a little bit warmer by next time we meet.
I hear you. Richard, can you introduce yourself or do you need a moment?
I think he had to walk away for a moment.
Okay. Bern, good morning, welcome.
Bern Hertzberg, ARC 16, Fort Washington.
Okay. Carol?
Good morning, everyone. Carol Ban, Aging in Place Programs, Isabella, which is a member of MJHS Health Systems.
Eris Slater?
Good morning, Aris Leda Jones, Aging in Place Programs. I work with Carol.
Emma?
Hi, good morning, everyone. I'm Emma, and I'm the program assistant. I'm working with Isabella Senior Research Center with Carol Ban.
Thank you. Ilana? You're muted, darling. There you go.
Riverstone Senior Life Services.
Julie?
Good morning, everyone. Shuli Gutman, Mariah Senior Center.
Dory?
Good morning, everyone. Dory Garcia, ARC 16, Fort Washington, Inc., Assistant Executive Director.
Susanna?
Susanna, you're on mute.
I don't think she's familiar with the platform.
Okay.
So.
We'll come back to her, Marie.
And I will say, I'll introduce her.
Oh, okay.
Susanna Cesario, some of you may know her. She's an exercise instructor. And so Susanna she's working as a temp with me in the El Corazon neighborhood, Newark. And I also should announce that Maciel Veras would be here, but she gave birth to a baby boy and she's on maternity leave until August.
We congratulate her. Marie?
Good morning. Good morning. We'll stay all dry. Marie Carmel Garson, nurse practitioner from Columbia Doctor's House Call. I visit patient at home. Take care of the homebound population from Inwood all the way down to Morningside. Thanks.
Thank you. Doreen?
Hi, good morning. My name is Doreen from Defdale. I am attending on behalf of Verna today.
And thank you for doing such. I appreciate that. And we all do. Welcome. Richard, are you able to introduce yourself now?
Richard Allman, member of CB12, Aging Committee, working for ARC Fort Washington.
Yeah. All right. So we will.
Is Glennis still on our committee, by the way, Mary?
I'm sorry?
Is Glennis still on our
No,
committee?
she is not. No,
She's
she
not.
is not. She hasn't been for a while.
Okay,
And
fine.
I actually spoke to Ebenezer at length yesterday about a few things, and that was one of them. So
Got it. Just want to confirm. Okay.
yeah, so you don't even, list
Got
her
it. I got it.
as anywhere. Okay.
And Mary, am I still a public member?
Who's asking that? I'm sorry.
Fern.
Fern, yes, you are.
Okay.
Yes. And Dory, we're working on your public member application. Okay. I spoke to Ebenezer about that yesterday as well. He and I had a long chat at the office, which we haven't done in a while, and it was nice. All right. So let's get started with our agenda. We've done the first and second part. Let's have our presentation by Carol Ban on benefits enrollment and outreach.
Very good, thank you. So how do I share my presentation?
Ebenezer is going to set you up so that you can do that.
Okay.
Or you are co-host already. You can do your
Okay.
presentation.
So you should see.
No,
You should see a share screen.
bottom.
Yes,
Yes,
check it out. You are
okay,
co-host now.
got it. Okay, thank you. Okay. Okay. So hello again, all my colleagues. I'm really grateful for this opportunity to present today about Isabella Senior Resource Center, which is a benefits enrollment center. This is one of 4 programs that are under Isabella's Aging in Place programs, which I oversee. We also have 3 NORC programs. And before I start, I wanted to introduce my team, my colleagues at the Resource Center. Arisleda Jones, she introduced herself previously. Arisleda is the benefits specialist for the Resource Center. She's just constantly working on benefits with individuals. And Emma Castellan, who's been with us since the pandemic started, is the program assistant. And she wears many hats, but she answers the phones, but she does everything else, and she covers for Arisleda when she's not there. So that's our team. Everyone's bilingual except for me. Okay, so our history. So Isabella opened this storefront called Isabella Senior Resource Center on Broadway and 169th Street in 2003. And, the idea of that was that it was going to be, a way to promote awareness about all of Isabella's many services to the community. But it evolved. And it was the people that were coming in from the community, they wanted benefits. Medicare Part D just came out. They needed to get on that. They wanted some social activities, computer training. So the Resource Center evolved to provide all these different needed services. And in 2006, the El Corazon Neighborhood NORC opened, and it became a co-location for the Neighborhood NORC program, which covers 40 buildings in the community, as well as a senior resource center that was primarily doing benefits assistance. And 9 years ago, we started to be funded by the National Council on Aging, and we became one of now 100 benefits enrollment centers nationwide. And we've had that funding for 9 years, and it really partially funds our benefits enrollment center. There are 2 other BECs in New York City. Live on New York has a benefits enrollment center, and Sydney, CIDNY, the Center for Institute of Disabled New York. They've also been a BEC for 9 years, and we each do it differently. All of these BECs around the country have a different method. There are some that do strictly telephonic. There are some that work on Native American reservations, and they have to travel 200 miles to see their clients. They work with tribal leaders. So it's very diverse. Our location on 169th Street and Broadway in the storefront was an amazing location because we had a lot of foot traffic, and we operated as a walk-in center. And referrals came from people passing by, word of mouth from existing clients. We got referrals from the hospital, the emergency room. We did outreach to the local pharmacies. We went to food pantries and stood in line, letting people know that if they were food insecure, that they could come and get SNAP benefits. And we just appreciate, and we also appreciated being able to refer our clients to ARC in Washington Heights and to Riverstone, because there were things that we couldn't do, like housing applications or the tax credit. So we worked together very closely. And in March 2020, along with all of you, we had to close our office and we transitioned to assisting clients from home. Few months, like 8 months later, we had to give up the retail storefront rental because the pandemic had no end in sight, and it was so uncertain whether we were going to be able to come back. And the rent, as you can imagine, on Broadway, it was very high. So it was a sad thing, and the clients were a little confused, but we did successfully transition, which I'm going to talk about, and the staff will continue to work by phone for the foreseeable future. And I'm going to be sharing with you in a bit about our challenges and solutions, which hopefully will help you or resonate with you. Okay. So what services does the BEC provide? So our main goal is to assist individuals to secure benefits, assist individuals to secure all the benefits to which they're eligible, and to help them maintain their existing benefits. So we do applications and we also do renewals. And as you know, benefits assistance can be a very lengthy process. It involves eligibility screening, education about the benefits, helping them to get their documents in order, filling out forms, getting their signatures, follow-up, and a lot of troubleshooting. So as we all know also, relationships and trust are at the heart of everything that we do. And it was critical for us while that storefront was, the gate was down, we had signs, but people maybe didn't read the sign, or they didn't understand. We kind of like abandoned them, or they felt that way. And it was very important to us that people that we've known for many years, helping them with their renewals and becoming a part of their support system, we wanted to make sure that they knew that we were still working, we were still operating, just in a different way. It was all very confusing, but we decided to be able to stay in touch with them, that we purchased a subscription to something called One Call Now. It's part of a company called Unsolve, and you know that you get the idea that it's a recorded phone message service that we use, and we used with the Norks for many years. And it gives us the ability to, in our own voice, in Spanish, and then also to the English-speaking clients, to record a tailored message, whether it's about the pandemic, whether it's telling them to remember that the office is closed, but we're still here. We sent them all kinds of messages to be able to stay in touch with them, and also to let them know during the pandemic that someone cared. We did the calls, we did those outreach calls, as all of you did. In our storefront, as you can imagine, clients used to bring their mail for our translation and also for problem solving. They'd bring piles of mail often that we'd have to sort through in order to find the important letters or their ID documents. And this was really our main method of helping them, by reading the government mail and figuring out the next steps. And of course, during the pandemic, as we all had to do, we had to find new ways to assist them. And we also assisted them with all of those COVID benefits and services, as we all did. The vaccinations through the NYP portal, they get food. I don't want to name them, but you know what I mean. It was a lot. So who do we serve? Our BEC serves adults age 60 plus, as well as younger adults with disabilities who have SSI or SSD or are in the process of applying. I think that this might be a way that we could help your staff, since we can serve the disabled children of your members. I don't know if your staff has the capacity to do that, but that's one little niche where we may not overlap, and we may be able to be a source of help to you. Our clients are like many of yours. They have income under, the majority have income under $10,000 a year, and they immigrated from a host of Spanish-speaking countries where they often received only an elementary school education. They worked in this country at jobs that often did not earn them Social Security, which is why in retirement, many rely on SSI, which is, I'm not exactly sure what it is these days, but it's over 860, I think, something like that, which is not a lot to survive on. So these government benefits, as we know, are their lifeline. Our catchment area is not limited to Washington Heights, but extends to all 5 boroughs. One challenge we face in outreach is, during regular business, we used to get people walking in who needed new applications, and that's been tricky during the pandemic. The people that we call are like, we took 1,000 clients from 2019, and we populated our phone messaging service with those numbers only. So it's been a challenge to get new clients to outreach to people who need new benefits, who don't have them. So the benefits that we assist with, I think I'm preaching to the choir here, but I'm just going to go over them very quickly. So there are Medicare benefits. Extra help is to help people pay for prescription. It's prescription coverage, and they only have to pay like $3 for a prescription. And you don't have to be eligible for Medicaid to have this benefit, or to have the Medicare Savings Program benefit. That benefit helps people to pay for their premium, which is now $170 a month, which is a lot of money. And if they're eligible by income, it either waives their premium or it gives them a discount. Medicaid, as we know, helps people get health insurance. SNAP, people are eligible even if they're not eligible for Medicaid again, and they may not realize it. Helps them to pay for groceries. EPIC is also for prescriptions. HEAP is either for heat, which goes along with Medicaid, it's automatic. But in the summertime, we can apply for people so that they can get air conditioners, or for their air conditioned service to be paid for, the electricity. We also do a lot of SCREE applications, and entry. Okay, so now I'm going to talk about some other services that we also do referrals. We refer for immigration. We refer to NIMIC a lot for income, for the tax credits, for legal assistance. Well, you folks all do the same. Okay, so I think I covered all of that. So the challenges that we all faced during the pandemic, we faced constantly changing and evolving services and changes to benefits that we had to constantly keep up with. There was an onslaught at the very beginning of all these benefits, but I will discuss where we're at now, but it was changing. Medicaid, for example, they did all kinds of accommodations and waivers and easements so that people would continue to get their benefits even if they didn't renew them, that they get automatically renewed. It wasn't across the board, and some people lost their benefits regardless, so we had to keep on top of that. We also faced challenge in transitioning to a new way of providing benefit services without the face-to-face contact. And you can imagine, as you know, doing benefits, you need that tactile, or the clients didn't know how they're going to do this without that tactile one-on-one contact. This involves paperwork. So it is a challenge. Many clients used to like to go to the government offices. They wanted to have control over that application. It wasn't always a successful process regardless, but they insisted to go to the government office, which now are closed. So technology, so the government offices, HRA, Human Resource Administration, they administer Medicaid and SNAP. And they've been encouraging us for years to use their website and their app to do benefits. But these clients, they weren't ready for that. They don't experience technology. Most of them weren't using it. You know, it's expensive to have Wi-Fi, or they didn't have devices. So this was like a big change, and they didn't trust the process. So it took us a long time to get them to agree to use the technology. I'll talk about that in a minute. There's also been great difficulty getting in touch with government offices by phone, you know, be hours waiting. But I have to give credit to Arisleda and Emma, because they were very persistent in trying to do this. But there was a point where at Social Security would not allow three-way conversations, and the clients couldn't navigate it. So there have been a lot of challenges. So I'm going to talk about the solution. So as many of you did, we initially figured that the clients are going to have to send us their application, their mail, their documents somehow, and we figured out they'd have to do it by taking photographs. So we had to either teach them, or we had to encourage them to use their family or their neighbors to help them how to use this camera and how to send us the pictures. So there was a lot of, that was a process, but I think that we've come a long way in that. They use WhatsApp a lot to send us their pictures. It also took years of encouraging them, but we finally, I think because they were desperate, they were going to be losing their benefits if they didn't come on board to allowing us to help them to create an email address, even if they don't use the email address. But we were able to create an email address to, I'm sorry, I skipped something that I want to talk about. That's why I'm kind of blocking. But the email address, and to give us permission to sign them up for these accounts online so that we could get them SNAP, Medicaid, and also some Social Security benefits. What I forgot to tell you was how we managed to do this at home was MJHS gave all of us laptops and smartphones. And we also got the resource center staff got printers. So, and we also got a post office box nearby to where Arisleda lives. We also got postage and mail, mail supplies. So we do a lot of this by mail. We send them self-addressed stamped envelopes so that they can return things to us, like signatures. It's tedious, but we've had to, and especially when the mail slowed down, but we've had to, stay detail oriented and persistent, and we've managed. It takes a lot more time, but we have become, I think Arisleda, I shouldn't say we because I don't do it, but I know Arisleda and Emma, they've become experts at this. We get permission from the clients written permission through the mail to do these to do the internet websites. Accounts, to allow us to make accounts for them. So I think I'm just going to talk now about a few updates that, whoops, what happened? Okay. I just wanted to give you a few updates. I wanted to mention, I don't know if you're aware that the Manhattan office actually reopened today. We were so happy that recently we had an online meeting with Shirley Saxton, which you may know. You probably know her. She's the public relations for Social Security Manhattan offices. And we reestablished that connection with Social Security. And we also established a connection with the field office manager at the Inwood Social Security office. And I think his name is Mr. Quintanilla. He's been very, very helpful in troubleshooting things that we would never have been able to do. So they're opening. Now I will send you something afterwards about this opening, which they were closed except for only urgent situations. Otherwise, people weren't walking in, and they had no recourse but to use the online site if they were able to do it, or call. And the calls were really, really bad. It was very, very delayed. So the only problem now is what they're telling us in this letter, they're discouraging people from coming because they're saying you should still use that website because it's going to be very crowded. There's going to be social distancing. They're not going to be able to accommodate everyone. So it's going to be a transition. They're willing to do a presentation about their website. And, you know, you're welcome to call Shirley Saxton. So that's Social Security. I also want to tell you about Medicaid. So Medicaid has had easements, which means that people are supposed to not be cut off from their benefits, even if they don't submit documents like they would normally do for a renewal. If they fail to submit documents, their Medicaid will still be active and extended through May 2022. They've been extending it continuously. Every month you hear if it's going to be extended or not, but it's managed to be extended. Any case that's closed during the COVID emergency for failure to renew will be reopened, they say, and coverage restored. But you know that takes troubleshooting sometimes. And SNAP, they've extended their waivers through May 31st as well, which just means that there's a partial interview waiver. I'm not sure what that means. And people can submit their benefits by telephone. In other words, they don't have to actually submit the documents. And the last thing we want to hear is about another scam, but there is another scam called skimming, which I learned about this from HRA. I got a memo that affects EBT card use. Basically, when you're a supermarket and use that machine to scan your EBT card or whatever card, there can be an overlay on top of that machine that looks weird. And that is put in there by scammers, although I don't understand how the market or whoever is managing that device wouldn't know about it. So I'm sure we'll be learning more about that. Whoops. And this is our contact information, which I'll be happy to share with you through Mary in an email. I'll send these different things I'm mentioning in an email to Mary. And I guess I will open it up for any questions. And I'm going to ask Arisleda if there is any question about benefits, if you could please answer. Any questions? No?
So I have
Committee members first, okay, if we can. Go ahead, Fern.
So how are you doing at bringing in new clients? Because it seems to me that while working with existing clients virtually is pretty much something we've all done, bringing in new clients virtually seems to me like a major challenge.
Absolutely, it is. So, you know, one thing we've done is we realized that there was a gap at MJHS. This is in my discussions with my marketing department, you know, colleagues there, that the hospice, for example, the hospice department of social workers, they are not able to do benefits. Their clients are in desperate need of them. They need Medicaid, you know, families need Medicaid to help their loved ones who are sick. People die and then the survivor is left in need of benefits. You know, maybe a spouse needs benefits now, they lost some income. And so we presented there, and those social workers really are very appreciative. It's like a little niche. Also, you know, Social Security, we're by the way, we're getting some strange, we're still getting the hospital. We're on a listing at the hospital on their network. And so Arisleda gets calls from social workers at the hospital, so which we're really grateful for. And we're getting calls from, we were on different lists. We're on Hindsight, and NCOA has us listed, and we do manage to get some referrals that way. We don't have the capacity, so we're getting referrals, let's say, from the Carter Burden Center, which is in, you know, on the Upper East Side, so which is unusual. And the NORCs have been my NORC. I don't have a social worker right now in the River Terrace NORC, so I am referring clients. And of course, we have deliverables, just like DFTA has deliverables. we have deliverables to our funder, National Council on Aging, but we have not, they understand that we can't meet the deliverables partially because these Medicaid extensions where some people just aren't bothering, they're just, letting it go. So our numbers are down and we're have to come up with little by little new strategies, but we only have 2 people. We used to have volunteers in the office as well. So, they can only do so much because everything takes longer. So I just want to say one more thing. The SNAP, we are going to come back to the office one day a week at Isabella and do some outreach, go back to the pharmacies and go back to the food pantries. I'm sorry, I cut you off. I'm going to say.
No, it's okay. It was just going to be a suggestion.
Yeah.
That perhaps what we want to do is through the either CB12 Aging Committee or through the Waikoa Community Directors Group, that we get a piece of literature out there for the newspaper that says what's available locally, that, people can call the resource center, go to senior centers and so on, because I understand that surviving and getting internal referrals from various parts of Isabella's programming is a good stopgap.
Right.
But I think that the broader community needs to know what you do, and in fact, what all of the centers do in terms of benefits and entitlements for the people we serve. And I think that just doesn't get the kind of publicity that it needs.
That is a very good point. I was told that it was expensive to advertise.
But I'm not talking about an ad. I'm talking about an article.
An article.
In both Spanish and English, because the Manhattan Times would publish it that
Right.
way.
Of course. I think that's a great idea.
Yeah.
Also, Mary, Diane Ashley is on as an attendee instead of panelist. If Ebenezer could switch that over.
Ebenezer, can you take care of that, please?
Okay, I'm going to switch off this PowerPoint.
Okay, thank you.
Any other questions?
Anything from any other committee members? Hi, Diane.
Hi, guys.
Anything?
I apologize. I've been on since the beginning, but I had technical difficulties, so I just came as an attendee. Thank you, Ebenezer.
Gotcha. So any other questions from anyone else? Susanna?
Can I ask one more question?
Sure.
Yes, can you hear me?
Yes.
Okay. Yes, ask your question.
How are you maintaining confidentiality? Because I am extremely nervous and do not put emails and passwords into PeerPlace for clients. I actually literally keep paper files and put that kind of information into our paper files because I do not trust that the city will not get hacked. They've been hacked before.
Oh, wow. Well, we're not PeerPlace. We're not on PeerPlace. And I believe that they're keeping it in documents. We're HIPAA compliant, we're a healthcare organization, so we're extremely secure. And we do waivers, to allow, so that they allow us to create an account for them and to allow us to help on their behalf, No,
I understand, but once you've created the account to recertify anything or go back in, you have to have the email address and password. And in our experience, that rarely is maintained by the client.
Yeah, I had discussed it with Live on New York, and she was also using this strategy. There's like no other way to do it. But I know, I always feel confident, through Isabella and MJHS that everything is highly protected.
Any other concerns or questions?
So you're all welcome to access the resource center, for anything, for information, or just, to refer clients. We're 18 and above with disabilities.
Okay, so Carol, you're going to send me the list with the
I'll send you the
contact
and I'll send
information.
you,
for
Social
everybody?
Security, the Social Security
Okay.
flyer.
And I'll send that out probably with the minutes.
Thank you.
All right. Thank you,
Thank you
Carol,
all.
so much.
Yeah, you're welcome.
All right. Richard, are you ready?
Yes.
So you're next on the agenda. You
Let me
got it.
do, I would say is probably a partial report today.
Okay.
I think we probably need to put a few more minutes into time and format for doing this panel. And where that came to my attention, what made me think about it in particular, other than it probably should have been thought, probably should have thought about it a month ago, was I had asked staff for available times for doing this forum, just sort of going into that automatic pilot of CB12 does its forums early evening on a weekday. I didn't get a response from 2 requests of staff, but it also made me think, do we want to do that kind of conventional forum, community board conventional forum, an early evening open community forum to be decided whether it's in person or on Zoom? Would we want to prefer to do something quite similar during the daytime? Or are we trying to present something in the context of this meeting? That, maybe we would do some additional publicity so some additional people would tune into it. I think all 3 of those are reasonable choices, but I think that's probably a discussion for the committee before we start talking about some of the other things.
Okay.
Well, who's the target population, first of all? We'll start with that.
I'd say those are companion questions. I have an interest, and I'll speak first person singular for the moment, because you're right, we haven't decided that as a group. In providing this information pretty widely in the community, there have been efforts at the community board to do some organizing and bringing together of LGBT people in Upper Manhattan. And we are an aging committee, and I suspect our senior centers are serving some LGBT people and probably serving more than we know, just because of how closets work. So I think those are probably both the preliminary questions, and I'm glad you added that.
So just to respond and to reflect on what you've said so far as well, if this is a little bit more about awareness for those that are in senior centers right now and being serviced by those that are on the Zoom right now, maybe we should pose the question to those that are here who are running the center, saying, if you announce to your constituents that there'll be a panel next month, 10:30, 11 o'clock in the morning on our usual spot, would you be able to canvass to get people to come to join the conversation? Is this from your perspective, if the target is people who are connected to the senior centers, it may not be as much though, Richard, you might be saying much beyond, but let's start there at least.
Can I add this much to your question?
Yeah.
I think if we do that kind of targeting, then the targeting is seniors in Upper Manhattan and not just the ones who are already in senior centers.
Right, but start with
Ones
this
who might
group.
benefit from.
Yeah, start with this group and then broaden out as well. But here we have people who are listening to us right now and saying, do you think we'd be able to bring a group together in your senior centers to, bring up a Zoom there? Should we go to one of the senior centers and host it from there? I would start with that and then talk about canvassing the broader Upper Manhattan. If that makes any sense. Mary, do you have anything else to add as the chair?
No, that makes perfect sense to me. I don't know. Well, let's hear from the senior center people. No?
Well, let me
Julie?
just jump in just one thing. I
Okay.
think that we should probably do it on Zoom because with the new variant starting to increase, and also I think you'll get a broader audience. So you'll get greater exposure to this important messaging. So I would recommend that we do it virtually. People have gotten used to it over the last 2 years, and I think you'll get much greater exposure. But that's just one point of view.
Except the difficulty has been with having the senior centers engage their clients in a virtual presentation.
Right. As you can
The
see
only
from our
one- the
meetings,
only
we
one-
don't have too many seniors logging in on Zoom. And we could also do a
Right.
hybrid, which is we go to a center and we also have a Zoom link available.
Our clients in the Norix, when we do, I don't know how it works in the senior centers, well, but our clients, they join in by phone. Even those that have access to the video, they don't want to use the video. So predominantly our groups, they call in the number, and then they call in a number and then one other number that they have to input. And that's how they join. And it's been amazing that they've learned that it works. I never would have done that before. I never would have thought that these phone groups were productive, but they have been.
So I would say throughout the pandemic, our way of reaching seniors group-wise was through the phone. Virtually all of our clients did not and barely have even now technology skills. So the phone by far has been the best option. Most of them know how to use WhatsApp, but they will also call into a conference call if it doesn't require a password or more than a couple of numbers and a password.
So building on that, that's what I was thinking, which is you do a Zoom, but you obviously make it available to the population that would rather just call in. We do that with
All
our
Zooms are allowed
member-to-member
calling.
program as well.
But I would add something else, which Ladies Group has done really successfully, and I would bet that Julie is too, which is bringing the Zoom into the senior center on a large screen. And then within the senior center, it's there. So people can call in, they can Zoom in, but they also can see it on this big screen right in the senior center.
Yep.
And that has also worked for us for some activities. It really depends on the plan and the expectation regarding interactivity, because you're talking about potentially having 100 or 200 people on simultaneously. So you would have to pre-choose who's going to ask representative questions, or are they really going to just be getting the information and not interactive?
I can picture how we might explain that on a flyer or whatever marketing we do, which is, this is the program. You can connect to it by Zoom or you can come to one of the following senior centers, which might be okay marketing too at the same time for other reasons. And that's a lot of type, but it's probably designable.
I'm
So
just
senior
saying,
center-
I'm sorry.
Go ahead.
Go ahead, Mary.
No, go ahead.
I'm just saying that you need to be clear for people on what the expectation is.
Right.
Is the expectation that they will be able to ask questions or interact, or is the expectation that they are passively receiving a panel presentation? And it's just, I'm not offering a preference. I'm simply saying people have to know. And I
Anyone
will
else?
add, as Richard knows, that we've always had LGBTQ representation in almost all of the senior centers.
Also, we haven't gotten a chance to connect, but Richard, if you'd like MJHS Hospice to participate, I know I brought this up earlier.
Yeah.
Please send me an email. You can also reach out to Carol, who can get to me, but we are SAGE certified, and our staff have advanced training in care and sensitivity of end-of-life issues that are particular to the LGBTQ community.
Amen. Let's come back to that in a minute when we talk about content.
I'm sorry.
Yeah, no, it's fine. It's good. Do we have a decision?
Just one
here?
question. Do we assume that it's in Spanish, or we can't assume that?
I think it's more like we decide that. And I think
Okay.
it's perfectly reasonable to decide that.
I mean, I think we have to do it bilingual.
I think if we're doing it from a community board base,
Right.
it makes sense to do that. What I'm hearing so far, or with a little bit of extrapolation, is that we should do this within the on a morning or an afternoon. Perhaps it becomes our June meeting, maybe not June or September meeting. And that we want to target both seniors who are within the center and any other ways we can reach out to seniors. It means a little less targeting of what I'd call the broader LGBT population in Upper Manhattan, and that's a reasonable decision for us to make. I think it's worth talking a little bit about what I'd say in content, and then I think it leads real directly to what Diane was raising. Is this a program about resources, or is this more of what are the issues in LGBT aging? I know when I started thinking about this, I was thinking more about the latter, but let's see where other folks are thinking about that.
I agree with that. Yeah.
Can you
One
restate
point of
the ladder?
clarity-
What's the ladder again?
The latter would be a broader look at issues in LGBT aging.
Right.
It would be easier to bring in some of the academics at the Columbia Presbyterian Medical Center. I've met one person at Yeshiva who I think would be excellent for a panel like this, and I suspect there are more than that.
Richard, one point of clarification. I wasn't necessarily trying to sell our services. They could be speaking to their knowledge base about particular issues facing the community. That's really more the context, that they have expertise. So I wasn't necessarily looking to do a resource.
Misinterpreted.
I think Alana's been trying to say something.
Thank you for, I certainly support the latter, that more of a wider discussion about this would be more interesting and relevant. But in terms of the timing, for us, the timing for these kind of presentations is always right after lunch. Then we have a captive audience. We don't have that many people unless there's an activity here at 10 o'clock. It's not a full house at 10 o'clock. So I don't know if others share that experience, but 1 o'clock usually is the best time for these kinds of things for us.
So I too do not have a lot of people at 10 o'clock in the morning, and most of our centers, even if they are more morning people, the attendance grows as we get closer to lunch and right around lunch, whether it's just before or just after. Both work for us. But I also support the broader conversation. I think if we want to do resources, that would be something that says, for a resource list, please call Ebenezer Smith at Community Board 12. We have a list available and we'll send it out to you. But I don't think that's an interesting conversation. I think the interesting conversation is LGBTQ aging and integration in the community and being welcomed or not welcomed. How do people feel in the community in which they live?
I think if that's the sense of the group, and a couple folks, I made a list just of possible people or organizations.
Well, wait.
You want to
I think before you go to possible presenters, I would want to hear from more people on this group.
I'm gonna have to leave, sorry. I have another Zoom. Bye-bye.
Okay, thanks, Alana.
Sorry.
But I'd like to hear particularly from Shuli and Lady who run other senior centers.
Okay, for us, the best time to do is around 11. The thing is that right after lunch, everybody leaves. So maybe from 11 to 12, they could come here if they want, be more than welcome to have you here, and we can have the panelists here and put the big screen and have people join us soon as well.
I like that. That's better for us than 10, for sure.
So we have the problem also that our seniors don't come before lunch. And the truth is, during the school year, they're not supposed to come because we don't have access to the main space when the school is in session until after lunch. So our better time would be during or after lunch as well. And our lunch is at 1 o'clock. So that makes things a little more complicated. 10 o'clock, there's nobody here.
When does school end, Shuli?
Mid to late June.
So maybe this is a good late June program.
I think it's an ideal program for the month of June generally, with some flexibility in that. And we just need to look at any specific content.
Shuli, would any of your attendees Zoom in from home and not have to go to the center or dial in?
So we have attendees that join our Zoom programming, not everyone, obviously. We do have a certain Zoom contingent. The question is, would they come, would those people that are Zoom literate, is that your target audience? Or is your target audience probably more of my Zoom illiterate clients? I'm not sure. So they have to be once they're here, I call it a captive audience. I can put things on the big screen, they're here, they see it. If they're home, they have to proactively choose to attend this program. And sometimes the programs that are more important for them are the ones that they're not necessarily jumping in on. I haven't found a good solution for that problem, but they're not always their own best advocates.
Thank you, guys. Thank you for weighing in.
Okay.
Go ahead, Richard.
There was a majority there for after lunch, but it was not unanimous. And after lunch means 1 to
or lunchtime, because Shuli's lunch is at 1, but 1 o'clock is after lunch for us and for Lady and for Alana.
And I actually think for my seniors, lunchtime is not a bad time because I just put it up on the big screen in the dining room and it interrupts some of their conversation maybe. But those, I do set up chairs. I've done it before with certain nutrition programming, and I've set up some chairs that is directly in front of the screen. Some people choose to stay in their seats where they eat lunch and listen, and some prefer to take a moment and come to the, the center ring, so to speak. So I wouldn't mind necessarily a 1 o'clock time slot for that.
We can also promote it to the NORCs. We have the 3 NORC programs, and I'm sure some people would join, from home,
right,
on the phone. Yeah.
Okay. This sounds like we've narrowed it down to at least for a time of the day.
I think it's 1 o'clock Shuli, what were the issues you were trying to talk about in terms of different parts of June being better or worse? I didn't quite understand that.
I was asking Richard about when school ends, because she has the whole space once school is over, but it's only for a few months. So if we were aiming for a morning, it would have to be when there's no school. That's all it was
But
about.
it doesn't impact afternoons.
No.
We look at an early afternoon, either the first or second week of June, or third or fourth. I'd say anything that someone thinks.
Well, whatever you can pull your panel together for.
Right.
I'll do that. I would think we would be aiming for a panel of 4 or 5 people. The preliminary list, including Metropolitan Jewish Health Services, included both of our academic institutions up here, have a range of people. Both Yeshiva and Columbia Presbyterian has a number of people doing research or clinical work in the field or leading community programs. There's a pretty wide range there. SAGE is generally looked at as the expert in the field, both for the overview and policy work they do and the fact that they deliver services also. Among senior centers directly, the one that strikes me is Brooklyn-based Griat Circle, which particularly serves the African-American community and has a fairly long track record in serving LGBT seniors. And if we're doing the bigger picture discussion, then someone who's Brooklyn-based could make sense for us. I don't have anyone in mind who's been working on the nursing home issues, but I'd like to do a little bit of research just because people re-entering the closet when they have a need for assisted living or for nursing homes is considered a pretty significant issue. From the public sector, I haven't explored at this point what DFTA or NYSOFA may have to offer in terms of policy, but once we're ready to go, I want to make some calls on that and see if there are people who could speak to that from a public policy position. At City Council, on the Aging Committee, 3 out of 7 members are LGBT people, and I think it would be worth approaching one of those people. Within the context of the overall panel, I would want us to pay attention to issues of diversity and how the panel is composed.
Sounds like you have a very good plan in mind, and it really sounds, I'm enthused about it. I really am. And, I have certainly a lack of knowledge about issues of this kind, and I'm really excited about, being involved with this. Now, Richard, it's a lot of work for you. Do you have a partner in mind to help get this organized and set up? Certainly I can do what I can do, but.
At this, I think there are some let me see if I can say this not awkwardly. I think there are some roles for the chair. I think there's some roles for staff, particularly in producing materials. I'm glad to make a couple of calls. There remains a list from the efforts to pull together an LGBT task force at CB12. And I think from that list, there are some likely partners in doing that. And I'll own up to the technology part of it being my weakness. Or one of the weaknesses. So we'll be looking for a partner in that area too.
Gotcha.
Um,
All right.
Mary, do you need more specifics by the time of CB12's April Executive Committee meeting? I'm just wondering if that's a deadline, or we can we've got a month to give this more shape.
Yeah, hold on a second. Yeah, so the executive meeting is on the 18th.
I don't know if you need a specific report for them, but I wanted to check.
I'm sorry?
I don't know if you need a specific report, more details for that meeting, or if what we've done now is enough for the executive committee.
I think it probably is. At least for this month, you know. And by the executive board meeting in May, we should have everything finalized.
Okay.
So we have to. Go ahead.
And a question to Ebenezer. Whether staff can manage the Zoom connections and the production on the day of the program itself, and all the connections that need to be made.
Yes. You let me know when you send me the email the other day. I asked you whether the meeting going to be in person or remote. Once you have a date and we have a time, I make the arrangement to make sure that we have the coverage that you need for it. But I need the time and place is what I need to do my planning here.
Sounds fine. We'll do that. I guess I asked the extra question because I think it's going to be a lot more connections than usual. That sounds reasonable to you?
Let me know time and place. You know what my Zoom going to be arranged at. The only requirement that I have is that the time do not interfere with a scheduled meeting that we have.
We're looking at 1 o'clock. We're looking at daytime programs.
Yes, usually we don't have any meeting at 1 o'clock. So any day will be good. However, if it's the day of the general meeting, it's not a good day.
Understood and appreciated. Does the district cabinet meeting?
Okay.
The district cabinet meeting is on the third Thursday of the month.
Thursday, yeah.
And it's from 10 to more or less 10 to 12.
Here's some background noise. I don't know where it's coming
I'm
from.
sorry, they have making an announcement here. Let me close my mic.
Oh, okay, sorry.
Mary, let's take a minute. Let's take a minute at the end of the meeting for one more check-in with Ebenezer. Let him know what he needs to do right now.
Okay, that's fine. Are you thinking about a certain day of the week? That's another.
If
thing
there are any
to consider.
recommendations here, sure.
Sorry?
If there are any recommendations here on what day of the week, otherwise I think that'll be driven by putting the panel together.
I mean, any day is fine with me. I have no conflicts usually for that particular time. Anyone else have any issues or any days that are not good at that time? Any days of the
Why
week?
wouldn't we be doing this on the first Thursday of the month?
I'm sorry?
Why don't we do this on the Thursday, the first Thursday of the month of June?
Instead of our regular committee meeting.
I think so.
Is
Just do
that
it at
what
1
you're saying?
o'clock. Yeah,
But you're
that would be
saying
my
to do
first.
this, you're saying to do it on the first Thursday of June.
At 1 o'clock, yeah.
Instead of our regular morning meeting. It's fine with me. Anybody else?
That would be May 5th. Cinco de
Right.
Mayo.
Oh, no, it would be June.
June
June.
2nd.
We're
I'm
looking
sorry,
at June.
June 2nd, sorry.
June 2nd, yeah.
Okay.
Not June 3rd?
June 3rd is Friday.
Right.
I have June 3rd as, am I looking at a bad calendar? I have June 3rd as Thursday.
No, I have my calendar open.
No,
The 2nd is Thursday.
it's the
We're
3rd of
looking at June
Sivan.
now.
There's literally a
at June.
mistake in my calendar. Oh, I see what they did. My calendar says Wednesday the 1st, Thursday the 3rd, Friday the 2nd.
Oh, Lord.
They transposed 2 numbers on my calendar.
Got it.
Serious
Whoa.
virus. Let's make June 2nd a tentative date.
Okay.
If after a week or two of this, it looks like it would be helpful to have a couple of extra weeks and push it back a little bit in June, then let me come back to you and ask that. But we'll try.
Sounds good. Okay.
Ebenezer, are you available? Are you off the other thing?
I would make myself available to cover the meeting. I usually cover this meeting at 10, so we do it at 1 that day.
Okay, and the one other thing, if someone designs a flyer on this, can the office do the production?
Well, I can do a production of a very simple flyer. Send the information. The flyer that I can give you is this day we have this meeting. You know, if you want something more elaborated or something, we need to find some the other chairs. They do it themselves. But the traditional flyer, you are invited to this meeting at this time. In English and in Spanish, you have it.
Okay, let's check back in with you around the time of the May meeting on that. Thank you.
You're welcome.
I think we've pretty much exhausted this subject for today, yes? And we'll certainly have it on the agenda for next month again, in terms of updating. Is there anything, Shuli, from Senior Center Director meetings?
We actually had a meeting this week. Fern is probably better to update us on part of it because she attended another meeting shortly thereafter. There was some discussion involving the Department for the Aging wanting to terminate the grab and go lunch option as of June 30th. There are a lot of senior centers that think that that's not necessarily a very good idea at all. But it seems like that may very well happen on June 30th. For those centers that did not put it into their new contract, which is a significant number of them. So there was discussion around that. And Fern, do you want to talk about the union?
Sure. So the city council passed a law in the fall of 21 requiring us to engage in peace agreements with unions. And there was not a lot of guidance on what that means, but I'm involved with the Human Services Council, and there is a lawsuit against the city saying that this appears to abrogate the existing laws about unionization. Because how can a union represent anything if they don't represent the workers? And if they do represent the workers, then how can you force management to create or engage with unions where there's not really interest from the workers in unionizing? So the Human Services Council, Live On New York, Federation of Protestant Welfare Agencies, I believe UJA, all of the umbrella nonprofit organizations are engaged in that lawsuit together. That just barely got filed last week or this week. So it's pretty, all of this is pretty fresh. However, I raised it with our group because In the Human Services Council, there are organizations larger than mine that are already being approached by DC 37 or Teamsters or other unions. And nobody knows what our exact obligations and responsibilities are in that area. I do have 2 FAQs about the law. It's called LL 87 or the Labor Peace Agreement. Those are the 2 names it goes by. And Joseph or anybody else, if you want me to send you what there is about it, I'm happy to do so. But I will keep you updated as I hear further about it. But it's sort of odd because we have a long history of pretty serious laws, federal and state, about unionizing. And I'm not sure that the city can place a law that appears to not totally coincide with those laws.
Yeah.
So I want it to be an open conversation because anyone else who's hearing things about this, anyone who is engaged with a contract with the city of New York is required to sign an acknowledgement of this labor peace agreement law, LL 87, and to say that they will comply. And I actually got language from the Human Services Council sort of saying, well, we're signing, but we are retaining our rights to not maintain this if it is not better defined or overturned or whatever. So I have some language for that as well. So I don't know who has city contracts, but I know that anyone who has had a renewal after November or a new contract after November, it's part of your contract. And it will be going forward unless it gets overturned.
Wow. Okay, thank you. For the month of May, our agenda has been and is the beginning of discussion for the new budget that has to be worked on in the fall and finalized. I will send out again last year's budget items from, that were voted on last year and submitted. And hopefully people will come to the next meeting with some thoughts about anything additional or taking things off or whatever changes that we need to make for the capital and the expense budget. So that will be on the agenda for next month. Other than that discussion and further updating on this presentation for the LGBTQ community, are there any other thoughts about having a brief presentation of anything for May? If anybody has any thoughts, you can let me know by email or calling me, and we'll go from there. Is there any other new business we need to take care of or look at?
This isn't any new business, but I just have a quick question.
Okay.
Marie Garcon works in the home, and she's asking if anybody knows of an optometry provider that practices doing home visits. I don't.
I don't either.
No. Okay,
I don't have anyone. I'll inquire.
thank you.
Old business? Anything pending from anywhere? Announcements? Going once, going twice.
Hi, good morning, Mary.
Hey,
Hi, again, this is Doreen. I'm covering for Verna today. I have a few updates from DIFTA. Okay, so Lorraine Cortez Vasquez has been reappointed as the commissioner for Department for the Aging, and our Aging Connect department has turned 2 years old, and they have answered over 114,000 calls. And person in need of resources and services from DIFTA, they can call the hotline. The hotline is 212-244-6469, and people can visit nyc.gov/aging to receive a free monthly copy of DIFTA's newsletter. And I'm sure many of you already know that the older adult centers now can resume in-person programming at 100% capacity. However, all staff and participants should continue to wear masks or do their health screenings. And that's all my update.
Thank you. Anything else
Yeah,
from
Mary,
anyone?
I have a
Richard.
question. I don't know if anyone can answer, but in the media last night and today, I saw a series of articles saying the new state budget was likely to include funds for COLAs, cost of living adjustments for nonprofits. And I'm wondering if anyone has any more information than those stories.
There is a Just Pay campaign for just wages that's being run through that same set of umbrella groups that represent nonprofits. And that agenda is being pushed both on a state and a local level, but I don't know what the law includes at this point.
Okay. All right, so as mentioned earlier, our next meeting will be May 5th at 10:30 a.m. And is there a motion to adjourn the meeting?
I make a motion.
Second? Second by Rabbi Yosef. Thank you.
Okay.
So we are adjourning at 11:55 a.m.
Thank you, Mary.
Thank you all.
Good to see everybody.
Thank you, everyone. Nice to see you too. Bye.
Happy Passover to those celebrating next week.
You too.
Happy Passover.